an incredible contribution to these efforts, and it just shows you the spirit of people meeting this moment, the spirit that defines this moment, the spirit of generosity and support. And so I just cannot thank a World Central Kitchen enough for connecting themselves to this cause, connecting themselves to this movement, and providing those meals, working with local restaurateurs in each of the regions throughout the state of California to help support these efforts. So that's the framework of what we're doing. Phase one, 15,000 units, roughly 7,000 that we've already identified. We begin to move these contracts county by county, county-run, state-led in terms of providing the framework of support. But we recognize the county stress, the city stress, as it relates to resources. And that's why it's important that I remind all of you that we have provided some $800 million in addition to the work we're doing to identify these motels and hotels throughout the state of California. $800 million of award grants have gone out just in the last number of weeks. The $650 million that was approved in last year's budget to the cities and counties and our COCs to provide for support services and identify sites to address the homeless crisis, and the $150 million because of the leadership of Tony Atkins and Anthony Rendon that we were able to prioritize on an emergency basis just a few weeks back through our budget appropriation. So $800 million of grants, $150 million of the new dollars that are now out. Award letters have already gone out to support this effort. 75% reimbursement from FEMA. There should be no excuse for us to begin to scale these operations in the next days and weeks. And it can't come soon enough, because we had, of course, that one tragic death, the homeless individual in Santa Clara, and we had a number of counties in the last days that have reported incidences of positive test results in counties large and small, including San Francisco, but other counties in LA that have shown at least a dozen, in fact 14 in our last count. By the way, that's an undercount, we know. That's just what's been reported to us. But heightened concern around the need to do more in our congregate facilities to isolate people into shelters like this and provide those basic essential services as we work through this crisis. Just a few final points before I bring over the head of our homeless task force, Mayor Darrell Steinberg, to say a few words. It's important to note as well that this is also an operation being supported by the support of the federal government. $118.5 million of direct homeless grants have come from the CARES Act, the $2.2 trillion federal stimulus. So that's additional resources that we'll be quickly dispersing throughout the state of California to augment some of the concerns around these facilities being temporary. And I want to make this point before I bring up the mayor. The anxiety often is, well, this is wonderful to help us for 3-4 months to get us through this crisis. But what happens after that? If you're a county leader, you're saying, I'm not sure we are in a position to have the resources to continue these operations. That's why the federal dollars are important. That's why I'm highlighting them. And I also want folks to know at the county level and the city level, this was the crisis we needed to address before the COVID-19 crisis, and we're not walking away from meeting that crisis head on as we move through this process. And that's why these operating agreements or these occupancy agreements in places like this include extensions and all the new templates that we have just engaged in the last few weeks include purchase options, so that the state of California can help support through philanthropy, local government support, the opportunity to purchase these sites so we can look more long-term as this being part of our panoply of solutions to address the homeless crisis in the state of California. So it's a long way of saying this. We're not just thinking short-term. We're also beginning to process an orientation of focus and energy around long-term supports so that we can get people off the streets in a permanent way. But again, this could not happen without FEMA's extraordinary support and partnership, and the partnership of leaders like the leader I'll be asking to the mic in just a second. and that is the head of our homeless task force, the mayor of Sacramento, and someone who's been out front on this issue for years and is here yet once again to see this crisis of COVID and the crisis of homeless come together in a way that only reinforces this sense of urgency, but moreover reinforces why we're pleased and proud that he's mayor of Sacramento and leading the efforts throughout the state of California. Darrell Steinberg.
Thank you very much, Governor. Let me begin by thanking you. You often talk and have talked frequently over these last days about Californians meeting the moment. You are meeting the moment, and more than meeting the moment in every way here. And we're grateful and proud that you are at the helm and that you are leading not just on this crucial issue of homelessness, but on every other aspect of this unprecedented situation. So thank you. It was a little less than 8 weeks ago, I believe, that you stood in the state capitol and you delivered a State of the State address. What was unique about that State of the State address, it was the first time that anyone could remember that a governor would devote nearly all of his or her address to the issues of homelessness and mental health. And you called it crisis, and as you said a moment ago, your work with the legislature has put forward hundreds of millions of dollars before the crisis for cities and counties to be able to get people off the streets indoors, to serve their needs, to address their underlying conditions, and to keep them housed. And you asked your task force to come up with a set of recommendations, and much of our work was centered on the idea that maybe it ought to be required to bring people indoors, not just be an option. And you embraced that idea, but the idea was to take, with a great sense of urgency, a recognition that it would probably take several years before we were able to actually implement this in large numbers. And now, less than 8 weeks after that State of the State address, the COVID crisis has given us together an unprecedented opportunity to move up that timeline in a most appropriate and aggressive way. And so I want to thank you for highlighting this issue today, but more importantly, I want to thank you and your administration for providing the resources, the tools, and the technical assistance for our county partners and our city partners to be able to do what we all have wanted to do and now have the opportunity to do, and that is to bring people in, not by the hundreds, but by the thousands. For you alluded to it appropriately a moment ago. Unsheltered homelessness was a crisis before COVID-19. It is a heightened crisis during this epidemic. And if we do our part now, it could be less of a crisis as we come out of this. That is the incredible opportunity we all have together during this most difficult time. And I know on behalf of all of the mayors and the local elected officials, we are grateful to have a state that is, and an administration that is leaning in, that is partnering with us, that is providing us the resources. Our promise on the other side must be that we are going to do everything we can to implement this strategy as quickly as possible. So I thank you for the opportunity, and I turn it back over to you, Governor.
Thank you, Mayor, and thanks for all your support and leadership on this homeless issue. And let me just briefly update everybody on the total number of positives in the state of California, the number of hospitalized, the number that are in ICU. Total number of positives today reported 10,710 in the state of California. We have 2,188 individuals that are hospitalized and 901 individuals in our ICU. That 901 number represents a 10.4% increase from the previously reported number yesterday. We continue to do more and more on testing. Tomorrow, I'll be putting out some more specific and prescriptive strategies and guidelines and updates on our testing protocols in the state of California. We continue to procure a more physical space in this state, including nearby the Sleep Train Arena, and we're actually beginning the construction today on that project. All throughout the state of California, progress is being made, and on Monday I will lay out details of all the physical assets that have now been procured as part of our larger hospital surge program, including all of those 2,000 units of medical support that came from those 8 FMS sites that were procured through the President's support. As it relates to the issues that are our top focus in addition to homelessness today, we continue to also focus with acuity on what's happening in our skilled nursing facilities, what's happening with our senior centers and our adult care daycare facilities throughout the state of California. We said when the beginning of this epidemic that homelessness and our seniors, those were our top priorities. They remain so, and that's where so much of our energy and focus resides, and appropriately so, because of the vulnerabilities within those populations, within those communities. But more broadly, we're doing what we can to continue to take advantage of this lull as it relates to not yet being at peak, and taking advantage of every moment, every minute, every hour, and every day to continue to build our capacity and build our points of access. That capacity includes the amount of PPE that we're receiving from around the world through our own efforts, and again, whatever support we can get from the federal government. I promise on a daily basis to update individuals just as the proxy for PPE, the N95 masks. We have, as of this morning, distributed now just over 38 million N95 masks in the state of California. As I said, as soon as we get those masks in, we get them out as quickly as possible. We'll need tens of millions more, hundreds of millions of more masks, more broadly defined surgical masks and shields and coveralls and gowns and gloves, and those procurement practices and those supply chains are being activated, as I said, all around the globe. We continue to find and source more ventilators, found a few hundred more from the LA County region that we're retrofitting back up in Sunnyvale, Bloom Energy, and continuing to resource and stack up the ventilator assets as well. In addition to that, now almost 75,000, over 74,000 people have signed up on our Health Core website, which is just incredible. That's the human resource part of all of this. Remember, three-legged stool. You need the physical points of access in our hospital system. You need the appropriate protective gear and supplies, ventilators, not just gowns and masks. And of course, we need the people that are retired to come back, and those with expertise as radiologists and EMTs, paramedics, nurses, nurse practitioners, doctors, and the like, to get ready to participate in helping us support the surge. And we're triaging all of those individuals as well. And before I open up to questions, I just want to remind people you can help as well as individuals. Serve.ca.gov, serve.ca.gov. That's our website for information if you want to help folks like the folks that are now housed behind me. For individuals, for shelters, food banks, that's the site to go to, serve.ca.gov. It also has a volunteer link to Cal Volunteers, more broadly defined, of how you can volunteer, how you can contribute blood, not just time, at the blood bank, all the things that we are, I think, individually required to do more of at this moment. That's a site we've created, a clearinghouse, to help advance that cause and to help the collective cause of all of us doing more on a daily basis, including the admonition that I'll always end, remind you, continue to practice safe physical distancing and social distancing. Continue to practice physical distancing above and beyond any and everything else. We have done a remarkable job in the state of California. If we continue to do that job, we'll continue to buy us time before that peak so we can continue to do more projects just like this. And if we do that, you are quite literally responsible for saving lives. And there's no greater or more noble pursuit in life than able to look back at the end of your life and say you met that moment, and there are people walking around, their kids and grandkids, because you did the right thing just by practicing safe physical distancing, continuing to stay at home except for essential purposes. You'll have, I think, met that moment in profound and significant ways. With that, we're happy to answer any questions.
Thanks, Governor. We're getting a number of questions from different outlets about asking you to clarify who is paying for these hotel leases and who might step in to finance them moving forward once the pandemic is over.
Yeah, I tried to lay that out in my remarks. Let me reinforce more specifically. We have the first in the nation framework of support to have FEMA reimburse 75% of the costs as long as we do what we are required to do, and that's focus on a subset of the homeless population that are COVID-19 positive, have been exposed, or are high risk. And the job and the responsibility for the state is to provide the technical expertise to the counties to make sure that we are conducting and appropriating that commitment in the responsible and legal way. So that's 75%. As I said specifically, we provided $650 million of emergency grants. All those award letters, now 100% of the award letters are already out. Counties and cities were already spending that money against those award letters, but now all the award letters are out, which means the floodgate on all those dollars. And we put out $150 million in the last few weeks of emergency aid because of the support of the legislature. So that should address the issue of the 25% gap amply for the cities and the counties. And as I said, beyond that, very clearly, we are looking at our new leases, these occupancy leases that have month-to-month extensions and have the ability to have purchase of these properties through a right of first refusal, or at least a right of first offer on all the new contracts that we are now procuring. And we are not walking away from our obligations on homelessness. The state of California has entered into that space in unprecedented ways. And as long as I'm your governor, I'm going to be there doing everything in my power to support the cities and counties so that we can continue to keep people in an environment where they're safe, particularly in these non-congregate environments, not only through COVID-19 crisis, but to the extent we can begin to fashion a long-term strategy where we can continue to utilize these assets that we're procuring at this moment.
And to follow up on that, some homeless advocates are saying that people aren't being moved off the street fast enough at this point. Can you clarify how many people have been housed so far and how many you hope to house?
Well, with this specific program, and again, we have 58 counties, 470 plus cities doing a magnificent job. In certain cases, not doing good enough in other cases that continue all of their homeless operations with all of the new money that the state of California has provided. And so that is separate and above. But let me be specific to what we call Project Room Key, which is this program, 15,000 units that we will identify and procure under this new FEMA framework. Just shy of 7,000 have already received occupancy agreements, and we have 869 people that are already in hotels just like that, including 30 of the 34 units in this hotel. I want to caution people, we don't want everyone flooding in to all 6,867 of the existing rooms. That, again, number roughly 7,000. We want to make sure we create some slack so as we manage the situation and we decompress the rest of the system, we're doing it in a very judicious and thoughtful way. That's exactly how we're appropriating ourselves with the hospital surge as well. You don't want to run to capacity too early. You want to do it in a methodical way. So the answer to the question that the advocates pose is they're right. And we recognize good enough never is. But I'll tell you, I don't know another state that's gotten close to 7,000 housing units just in a few weeks that has an agreement, none do, with FEMA to get reimbursed, and now a real process and protocol that's bottom up, county by county, to begin to triage individuals and move them quickly and effectively and safely in an orderly way into hotel rooms, and I'm very proud of that.
A number of reporters also have questions about the state's modeling and when we're going to see a peak in the number of infected cases with COVID-19. So some models, other than the states, show the state maybe having a peak in April. I'm wondering, why is California's modeling different, and
well,
when? Go ahead.
I can't answer to what specific model someone else has. There's certainly national models that show April. We're in a very different place than, for example, New York. We're in a very different place than other parts of the country. There's a unique set of circumstances in this state. And every day it's dynamic. Every day we're iterative in terms of incorporating new data sets and new trend lines and updating our modeling. That's what our modeling shows. Our modeling's not done in isolation. It's done in collaboration. It's done with the systems, the healthcare professionals. It's done by taking a look at everybody else's modeling and incorporating some inputs on the basis of their expectations, and we recalibrate ours, and that's what our modeling shows. And right now, I can only say this, since we put those models to the public a few days ago, all they have been in the last 3 days is reinforced. And so we're standing by them with always our eyes open that on a daily basis those models get adjusted.
So when exactly is your modeling showing that California will hit the peak infection rate?
Well, as we showed everybody just a few days ago when Dr. Galley presented those models to the public, we were looking into the May month that we started to see things begin to peak. And so that's where we currently are. We don't have an exact date because every day adjusts, and I don't want to say on this particular date we're going to see a peak. Anyone who could say that is misleading you. And so on the basis of our current modeling, we are in those first few weeks of May.
Matt Levin, Cal Matters, asks, what's the status of the 1,300 trailers that were procured from FEMA, and how many have already been distributed and are operational?
There are 1,305 trailers, of which 584, I believe, and I'll get you a clarified number if I'm off by one or two, but roughly have been distributed throughout the state. All the rest we're trying to get out as quickly as possible. Again, the challenge is the state is not every part of the state, meaning I, as governor, cannot cite them against the wills of the local unless I want to get the local government to be supportive. So we're working with those governments like Sacramento, the city and the mayor, LA, San Francisco, others that have created framework of support. So once they take those trailers, they're actually being utilized. There's been some circumstances where we've given trailers and they're not being utilized. So we're doing this in a very thoughtful and methodical way. I should note that we just got another 28 that were contributed this morning. We're very proud of that. So we're now north of 1,305 trailers, but we're trying to get them out as quickly as those sites are offered by the cities and counties, and we're starting to see those efforts at the local level really start to bear fruit.
John Ruich of NPR asks, given the ongoing challenges in procuring personal protective equipment and ventilators and states bidding against each other, what specific changes would you like to see FEMA and the White House make today to improve procurement, supply chain, and delivery challenges during this pandemic?
Look, I'm not going to offer advice at that scale. I'm dealing with a nation state at scale, the state of California with 40 million folks, and we are working very, very collaboratively with our private sector partners and within and around our supply chain, and with FEMA specifically. We are blessed to have Bob Fenton, who's the regional FEMA administrator, who happens to be a resident of the state of California, and we're working hand in glove with him as it relates to that supply chain of ventilators. Clearly, the national stockpile will be insufficient to provide the ventilators that we'll need and the ventilators that will be needed for the rest of the country, and so that's why we're not relying on the national stockpile. By the way, we haven't received one ventilator yet, and I don't anticipate anytime soon that we'll get those vents. But rather than rolling over, rather than complaining about that, we're going out and we are securing new ventilators, and we're refurbishing ventilators in ways that I think would do, well, that make us all, I think, should make us all very, very proud. I want to clarify so people understand. There's been some reporting about roughly 170 ventilators that did come from the national stockpile. Those didn't come to the state of California. There's a separate agreement in LA County from the national stockpile for PPE. Those are the ones that came into LA County. As you know, we had to refurbish the vast majority of those. They're now fully operational, and they're back in the hands of LA County health officials. We have over, you've heard this number before, 4,252 ventilators that we have sourced ourselves and identified. We have a few hundred more that came in this morning. Not all of them are working. We're going to get them fixed. So I'll be updating that number in the next few days. But we are doing what we can to find as many vents as we can. And final point, Virgin Orbit is in our office as I speak, and they're showing their prototypes on these bridge ventilators. It's just another proof point of the kind of creativity that a lot of the manufacturers here in the state of California are advancing and offering their products in real time that we also hope can help bridge the need for many, many more ventilators.
Who's footing the bill for those companies that are, as you say,
The one yesterday that actually exceeded 2,700. However, we did reach a grim milestone because we now have more than 10,000 cases statewide, 10,297 to be exact. Sadly, we also had an increase of 60 deaths. The total number of deaths statewide is now 370. What we're seeing today, we think, is going to look more like the daily normal going forward, although we do know that there are still certain test results that are lagging behind. But the 13% increase in cases today is a much more, that increase is much more in line with what we expect to see